Hi students, so this is a recording of the rest of the cardiovascular system, and I'm going to start off here with the baroreceptor reflex. This is basically a reflex where we have these built-in receptors. They're called baroreceptors that detect changes in blood pressure, and according to those changes, the body can adjust the heart rate and the dilation or the constriction of blood vessels in order to readjust the blood pressure back to normal. So let's take the story from the very beginning. Where are these receptors? These receptors, again, they're called baroreceptors, are found in the arch of the aorta. Okay, so that's the arch of the aorta. So we have baroreceptors in here. And we also have baroreceptors all the way up here, and these are called the carotid baroreceptors, and they are found at where the common carotid artery bifurcates or becomes branches into the external and internal carotid arteries. So we have these carotid baroreceptors at the bifurcation of the common carotid artery, and we also have these aortic baroreceptors that are found in the arch of the aorta. And again, these are constantly monitoring our blood pressure. If the blood pressure is too high, or if the blood pressure goes down, decreases suddenly, there are certain changes that will happen in the body, and that is part of the reflex. So let's take a look at what that reflex could do. The So here we'll see that if the blood pressure is too high, what the reflex would do would send impulses. It would send impulses to the heart to reduce the heart rate. Okay, so the heart will beat a little bit slower. It would also dilate, send impulses to the blood vessels to dilate, and that also assists in lowering the blood pressure. So that would be the response to high blood pressure. But what if a person has low blood pressure or hypotension? What would the response of the body be? It's basically the opposite. Okay, so in that case, the reflex would send impulses to the heart through the sympathetic nervous system to increase the heart rate and to increase the force of ventricular contraction. It would also send sympathetic impulses to the blood vessels to constrict. Now, all of these changes in the heart, along with the changes in the blood vessels, that would elevate the blood pressure back up to normal. Okay. So, high blood pressure, hypertension, that is a very common thing that you guys will encounter with your future patients. The exact cause is sometimes unknown, but we do know that it tends to run in families. It could be due to increase in salt intake or increased exposure to stress, whether it's psychological or physical stress, for over a long period of time. We've also found that sleep apnea, obesity, and kidney disease, these are all risk factors for developing hypertension. It is also known as a silent killer because hypertension, the signs and symptoms are pretty vague. Maybe a person has headache, they're tired, there's lack of energy, and a lot of times these are kind of like brushed off as normal, quote unquote, normal things to go through, especially if you have this very hectic schedule. But in reality, it could be due to hypertension, and that's why we recommend that blood pressure is measured at least once a year, better if twice a year. And again, that's why it's called a silent killer, because it could be there and the patient doesn't even know about it, and it could lead to strokes, heart attacks, and to prevent high blood pressure is a better way than actually to treat it. So to prevent it, you would make sure that the patient is on a healthy diet, they have a healthy weight. If not, then they would need to get there through regular exercising, and you'd also want them to limit their salt intake. Now, the venous blood flow, if you guys remember when we were talking about the pressure in the veins, we said that pressure in the veins is very low, and that when we measure blood pressure, we're technically measuring pressure in the arteries, but not in the veins. So, how is it that venous blood that is found in the veins, basically have to go against gravity, especially in the lower limbs, and they need to get that blood needs to get back to the heart. So what's going to help that while the pressure in the veins is way too low for that to happen? So there are a couple of things. There are actually three things that help. First and most importantly would be skeletal muscle contraction. Okay, so as we walk, as we contract the muscles, as we um, we're wiggling throughout the day, like just sitting there and moving the feet, that is going to squeeze the veins and push the blood upwards. Remember, there are valves to prevent backflow. The fact that we breathe, okay, these breathing movements, as we inhale, it acts like a vacuum or a suction to vacuum the blood upwards towards the thoracic cavity. And as you guys know, there are smooth muscles in the walls of veins, and those are going to help in constricting, kind of like um, contracting those smooth muscles in order for the blood to flow upwards. But that is really of the least importance. What are really important would be the skeletal muscle contraction. We call that the muscular pump, and the breathing movements. So we all understand the importance of exercise and how that relates to a healthy cardiovascular system. Okay, so what are the benefits? The benefits of exercising is that it increases the heart pumping efficiency, it increases our hemoglobin concentration, it increases the number of mitochondria, not only in our skeletal muscles, but also in the heart. Um, the stroke volume increases because the heart becomes stronger, and all of that happens with a reduction in blood pressure and in heart rate. Basically, the heart doesn't really have to work as hard in order to become efficient. But we always advise patients to exercise, but what is the kind of exercise that is beneficial to them, to their heart? You need to let your patients know that heart rate must increase to about 70 to 85% of the resting heart rate, which, that's not really what you're going to tell your patients. Okay, you're going to tell your patients to get your heart rate up to 220 minus your age. So, for example, if your patient is, say, 50 years old, then their heart rate would have to reach 220 minus 50. And that would be their target heart rate that they would want to reach while they're exercising. And that exercise has to be at least 3 to 4 times a week, and each session between 30 to 60 minutes. Now, coronary artery disease, unfortunately, is another common thing to encounter in healthcare, and that occurs due to the deposition of cholesterol on the inner walls of the coronary arteries. And remember, the coronary arteries, those are the blood vessels that supply the heart. And due to the accumulation of or deposition of cholesterol, that's going to obstruct these arteries, and the amount of oxygen getting to the heart would not be enough. This is usually a triad where the patient has high cholesterol, has hypertension. They could also become diabetic, and all three of these are risk factors for developing a coronary artery disease. And this would lead to a myocardial infarction or a heart attack. So, how are they treated? If a coronary artery disease occurs, we use these two different kinds of procedures. The first one is called the percutaneous transluminal coronary angioplasty, which is basically commonly known as a stent. And there's a video here that you can watch and see how that stent is put in. But it is put in where the narrow portion, and it is inflated using a little tiny balloon, and then the balloon is removed and the stent remains, keeping the artery intact or patent. And then there's another procedure called a coronary artery bypass graft or a CABG, where we take another vessel, usually the femoral vein or a part of the femoral vein, and bypass the area of obstruction. And again, there is a video that demonstrates that. And so this concludes the chapter. If you have any questions, please let me know.